When a person comes into hospital, taking medicines is not going to be the most important thing on their mind. We know from some recent work that every patient admitted is likely to have at least one issue with what we call medicines reconciliation, which is matching up the medicines they're taking with the medicines that they've been prescribed when they enter a second care setting.
This can be an important problem. On many occasions, patients, if we get the drugs slightly wrong, it won't make much difference, but possibly in about 10% of cases there could be major ramifications.
So the first step is that when they're admitted to hospital, we have to try and find out what medicines they were taking. But more often than not, the person won't be in a state to be able to share that information with the health professionals admitting them.
In my experience, commonly there are major variations between what's written on the referral letter and what the patient is actually taking. And in an ideal world, we'd like to see the tablets themselves and talk to the patients. They're not always well enough to do that, and they usually haven't brought their medication with them.
When I had the accident at home, I thought, I must take my blood pressure tablets with me, if nothing else. The rest they'll sort out for me when I get there, not knowing that I was going to stay in hospital.
Having a wife who was an ambulance technician, she actually advised me to take not just the medications in, which is the best thing to do because it's got all of the dosages on the packaging, but a timeline as well of when I took the medicine. So just, basically what I took, when I took it, on a sheet of paper.
When patients come in to hospital, the problem with not knowing everything is that it could lead to issues with the patient getting the right therapy and things. And for example, a patient went to a hospital and they were on a chemo medicine, which we needed to monitor them for other problems and then possibly give them some antibiotics. But because we didn't have that information, we didn't really know what to do.
It's extremely useful that usually within 24 hours of admission, a pharmacist will investigate the drugs that a patient is taking, and usually the following day will receive information. So at the point of admission, it's very, very useful to have a pharmacist investigate the medication and iron out any problems.
The pharmacist, she came to me, it was a Friday afternoon. She wanted to tweak the medication. I was a little bit sort of dubious at first. I thought, well, I'll give anything a go just to get rid of the pain. And when she came back on Monday, I don't know who was the most surprised, either her or myself, because I was sat up in the hospital bed, bright-eyed and bushy-tailed, and felt absolutely fantastic. After, the intervention of the pharmacist, the pain levels now, it's manageable. I've got my life back.
If you're a patient, what I would say to you is make sure you bring a list of medicines into the hospital with you, or whenever you're going to see a health professional, take your medicines with you and take a list of your medicines with you. Ask for the opportunity to speak to a pharmacist about your medicines when you're in hospital, and make sure that when you leave hospital, the information is transferred with you as well as with the health professionals about what changes have been made, so you are aware of what you're taking and why you're taking it, and you're in a position to pass that on to the next health professional.
You must know what you're taking, and you must be able to get it at the right time.
If I hadn't had the list of the medicines, I honestly think it would have taken a little bit longer to come to a conclusion and for the doctors and the pharmacists to actually give me the right medication.
If as a patient you want more information about how you can help to support health professionals looking after you, you can go to www.ipharmacist.me, which will give you more information about transfer of care with medicines.